The management of sudden collapse can be summarised as a doctor's ABC action plan or doctor's ABC cycle. Dangers, responsiveness, send for help, open the airway, check for breathing and start CPR.
My son, good man, my boy, Cooper, son, alright.
Hun, something's wrong with Cooper. I want you to dial 111, okay? And ask for an ambulance. And you make sure you come back here once you're done, okay? Hurry.
Okay.
It's my boy. Oh, son. Wake up.
Infants are considered to be those less than 1 year. In the following action plan for infant collapse, you will see important differences from that of the adult and the older child. In particular, we do not exaggerate the head tilt in infants. Our head tilt will be gentle so as not to obstruct the airway. Leaving a collapsed infant alone without attempting CPR can allow the infant's condition to deteriorate. Approach the infant assessing for any dangers first. Make sure that you and any bystanders are safe and that the infant is not in any further danger. If there are real dangers present, it may be necessary to move the infant in order to keep them or the rescuers safe. Assess responsiveness by speaking loudly and tapping the infant's shoulder. If unresponsive, immediately shout or send someone else for help. Dial 111 for ambulance. Ask the person who makes the 111 call to return to confirm the call has been made.
Hey, dial 111, call an ambulance and come back and tell me when you've done that.
Position the infant on their back on a firm, flat surface, for example, a table or bench top. Open the airway with head tilt and chin lift. Place one hand on the infant's forehead and place 2 fingers of your other hand on the bony part of the infant's chin. Gently tilt the head back and lift the chin. Take care to avoid excessive head tilt that may obstruct the airway. Keep the mouth slightly open. Look for and remove any obvious objects in the mouth. Taking no longer than 10 seconds, assess whether the infant is breathing normally by looking at the chest for movement, listening and feeling for airflow at the mouth. If the infant is not breathing normally or there is no airflow at the mouth, start chest compressions. Use 2 fingers of one hand to apply the chest compressions. Place the fingers over the middle of the chest, just below an imaginary line between the nipples. Press down with a controlled action about 1/3 the depth of the chest at a rate of 100 compressions per minute. Give 30 chest compressions. After 30 chest compressions, open the airway using a gentle head tilt, chin lift, and give 2 rescue breaths. Continue with this cycle of 30 compressions and 2 breaths until advanced help arrives or the infant responds and starts breathing normally. If at any time the mouth fills with vomit, turn the infant quickly onto their side, wipe out the mouth and return the infant onto their back. If the infant starts breathing normally, place the infant in an appropriate position in order to maintain a clear airway and monitor breathing.
What's this? What's this? Look at these toys, Mummy. What's this? Wow! Oh, God. What's this? Big one, basketball. Oh, back in a minute, Mummy. Okay, cheers. Bye.
In infant choking, the management principles are the same as with adults and children. The rescuer attempts to create an artificial cough to expel the object. As we have already discussed in infant choking, the management principles are the same as with adults and children. The rescuer attempts to create an artificial cough to expel the object. Deliver 5 back blows initially. Hold the infant face down. The head should be lower than the chest. This is best accomplished by holding an infant on their front, along an outstretched arm, and firmly holding the jaw. Deliver 5 firm blows to the middle of the back between the shoulder blades. The aim should be to relieve the obstruction with each blow rather than to deliver all 5. If these 5 back blows do not dislodge the obstruction, turn the infant over and deliver 5 chest thrusts to the breastbone. Hold the infant face up with the head lower than the chest. The infant should be on their back, held along the outstretched arm. Although similar to chest compressions used in CPR, these thrusts should be sharper and at a slower rate. These cycles of 5 back blows and 5 chest thrusts are continued either until the obstruction is relieved or until the infant becomes unresponsive. The management of the unresponsive infant with choking is the same as the doctor's ABC action plan. However, it is important to check the airway for any visible object that may have been dislodged before attempting ventilations. Now return to the main menu to review what you have learnt. Remember, when survival is being counted down in seconds, you need an action plan already formed in your own mind that can be applied in any emergency and which will buy the casualty time while the ambulance races to the scene. In this DVD, we have attempted to prepare you with such a plan.